York and now California have become hotspots for the highly contagious immune-evasive COVID strains known as the BQ variants.
Some experts say that it's only a matter of time before the wave of infections spreads across the country. So we're going to bring in CBS News medical contributor Dr. David Agus to talk more about this and to answer some of your other medical questions. Doctor, always good to see you. So, BQ variants, what are they and why are they spreading so quickly?
So the BQ variants are a child of the BA.5 variant, so kind of a sub-variant. They are remarkably infectious. So infectious that they dominate over the other variants. And we've seen them go to the most common one now in the country. Started in New York, partly because New York tests and reports really quickly, whereas other states are much more delayed. And it's all the way out to California. So it's here in the country. It's immune invasive, which means that the antibodies that we use to treat it don't work for COVID-19. We don't yet know on the vaccines, but the initial data looks like they're still protecting against serious illness.
So, Dr. Agus, as you know, RSV infections are overwhelming hospitals. In Orange County, in California, a health emergency was declared. Can you explain how RSV spreads, how parents can protect their children, and why now? Why is it becoming a thing now?
So for 2.5 years, nobody got anything. And so now kids classically get RSV when they're young. They're all getting it at once. So instead of, a small amount every year, it's basically every child over the last 3 years who was born is getting RSV. RSV is spread through droplets when you cough or sneeze. But this is different a little than COVID-19, and that's also spread from surfaces very easily, and it's very robust. It lasts on surfaces. So you touch that doorknob that somebody wiped their nose and touch, you can get RSV. Kids have no immunity to it, so they're getting really sick, and that's why there's this emergency in California, because ICUs, pediatric ICUs, are being filled up, is that they're all arriving at once with this virus and a significant hospitalization rate.
So now to our questions from the public. This person asks, is it true that there are no human studies on the most recent COVID booster?
Well, the most recent COVID booster now, we did it like the influenza shot, where it was very similar to the first ones. We just changed part of the spike protein, and then it was released, and we kept real-world evidence. We now have data on over 25 million people showing remarkable safety, no real serious issues, and at the same time, it's getting very robust antibody and T-cell responses, so looks excellent. But they're right in that it was released with real-world evidence rather than doing the clinical trials and waiting 6 months for that data. It was done in the real world, and it looks very, very, very safe.
So this person, Dr. Agus, wants to know how soon they can begin working out after a COVID infection. Okay, I have this question too, because I have not been to the gym.
Really?
I had COVID about 3 weeks ago.
Yeah.
I haven't been to the gym. I was sort of saving it because, I play in this bar band, and to push air from your diaphragm, I didn't want to exacerbate whatever I had. So that was why I was waiting. But I also have heard, Dr. Agus, that if you work out too quickly, you can exacerbate the infection even if you're over it, and that could point to long COVID.
No, so it certainly working out too quickly does not lead to long COVID. I think that's clear. What you need to do is to listen to your body. I love the fact that you work out. If you start to get tired or you start to get short of breath, you need to stop at that moment, take a rest, and then you could start again. The key is that listening, but don't abstain from the workout. It's not an excuse, Vlad, to say, I'm going to stay home from gym for the next 3 or 4 weeks because I had COVID-19. We got to get back. Your lymphatics that control your immune system have no muscle in their wall. It's actually the rhythmic contraction in your legs when you walk that make your body work. The more you move, the better you will do.
That's good.
Well, heading back.
Yeah. So listen, this is sort of a different kind of question before we let you go. We are entering into the holiday season shortly, or as I call it, the feeding frenzy season. And then right after that, it's the, oh my God, I got to pull it together season. Because
really
summer, that's what I think about the next few months. That being said, there are diets and there are diets. It's really difficult to determine, what diets are healthy, what diets are good for weight loss. Sometimes they're not the same thing. Do you have a diet that you recommend?
So it's not me, this is the data. So in every study to date, the healthiest diet by far was what we call the Mediterranean diet. It's good fats, good protein, chicken, fish, grass-fed beef, etc. But one of the keys to really staying healthy and to losing weight is eat your meals around the same time every day and no snacking at all. One snack in between a meal, even if it's the healthiest food, will change your metabolism potentially for several days. So the key is, fast in between breakfast, lunch, and dinner. Or if you're a 2-meal-a-day girl, do it twice a day. The key is, nothing in between those meals. Same amount of calories, you will lose weight.
That I find so interesting because I actually have not heard anyone say that
Me neither.
before, like that specifically.
Yes.
And it's a very simple rule that you can follow. Sometimes these things get so out of hand, your macros and your micros, and you're calculating your calories. Just don't snack. It's so simple.
I have in the commercial, I have something to tell you about what Dr. Agus was sharing.
Okay.
I mean, because
Mysterious.
no, it's okay. So
Dr. Vlad.
No. All right. So let me just say it. It's that, since COVID, you don't eat as much because you're tired and you're a little feverish, right? So you're eating a lot of soups and things. And what I've realized is, as hardcore as I was before COVID with working out and being cautious about what I eat, I switched to regular eating,
Right.
during and
I just
after
gotta get
COVID,
by here.
and I'm doing okay.
Look at that.
I'm doing okay, Dr. Agus.
Doctor, it's always great talking to you. Thank you.
Thank you, guys.
Thank you, as always. If you have more medical questions, send them to Dr. Agus. Please don't send them to Dr. Vladimir because we don't really know what we're talking about. We're as susceptible as you are when it comes to diets.
We'll
and fads.
forward it to Dr. Agus.
Exactly. You can tweet Dr. Agus at David Agus, or you can actually text him at 310-299-9322. We're going to have Dr. Agus on the stream every Thursday morning, and he might answer your questions.